Hi, I'm Dr. John Minichetti. I'm currently the president of the American Board of Oral and Implantology, and I'm excited this evening to interview our vice president of the American Board of Oral and Implantology, Dr. Joseph Leonetti. Little background. Dr. Joseph Leonetti is a graduate of Tufts University School of Dentistry, and he completed his fellowship in dental anesthesia at the Medical College of Pennsylvania. Then he went on to do a residency in oral maxillofacial surgery at New York University, Bellevue Hospital in New York, New York. And he's now attending the Paola Memorial Hospital and Surgical Center. And he maintains a private practice in oral maxillofacial surgery at the Mainline Center for Oral Surgery and Facial Surgery in Paola, Pennsylvania. So please welcome Dr. Joseph Leonetti. Thanks for joining me tonight.
My pleasure, John.
So Joe, it's in our purpose tonight just to get some questions and information out there to our diplomats and to those candidates that are seeking diplomat status. So I have a series of questions for you, and I'd like to get your opinion on some of the stuff that we've been doing. So I'm going to start by asking you, as a board oral maxillofacial surgeon, from your perspective, what would be the benefits of becoming board certified with the American Board of Oral Implantology?
Well, you know, John, I certainly believe there's a big difference between dentists that do implants and dental implant experts. You know, for those dentists that want to provide implant-supported restorations for their patients, they must commit not only to ongoing education, but expand their clinical experience in the art and science of dental implantology. So to help in this effort, the ABOI has a mission to certify individuals at the highest standards of competency in diagnosis, surgery, and prosthetic treatment in the specialty of implant dentistry. As a specialist, I have found that achieving ABOI diplomat status was an excellent opportunity for me to improve on the many comprehensive skills needed to succeed and interact with my colleagues in dental implantology. Specifically, as a surgical specialist, I was particularly empowered by the additional training in diagnostics and treatment planning, occlusion, and aesthetics, and many other areas that expanded my satisfaction and competence and prepared me for the ABOI certification.
Yeah, so that is a good perspective, because that's true. I've heard for some prosthodontists too, they get the better surgical experience and interaction. So wonderful to hear that from someone who's a specialty already in oral maxillofacial surgery. Thank you for sharing that. This year, you are chairman of our oral examination committee. So I think all the candidates probably realize that there are two parts to our examination process, the written and oral. So as chairman of the oral examination committee, can you tell us what changes were the ABOIs going through this year to make the process better for our applicants?
Yeah, I'll try. As you know, the oral exam is the final step in achieving diplomat certification within the American Board of Oral Implantology. And in preparation for the oral exam, candidates must complete a number of comprehensive requirements, which includes documentation of CE, dental implant case completions, and a written exam. Once these requirements are satisfied, our candidates can challenge the board for diplomat status. You know, the Part 2 oral examination is set up so that there are 4 stations of standardized cases which the candidates rotate through, and they have to defend a diagnosis, discuss the treatment plans with examiners, and as well as demonstrate in-depth knowledge of the surgical and prosthetic phases of dentistry. As chairman of the committee this year, I've strived to continue the tradition of providing a comprehensive and fair examination for our colleagues to achieve diplomat status as in the past. But a few changes have been made to help in that effort. Specifically, the exam has been redesigned somewhat to include scripted exam questions for the exam to better equilibrate the psychometrics for candidate performance. And in addition, the exam has recently been updated to rebalance and equilibrate the grading for each of the standardized stations, namely implant surgery, implant prosthetics, complications, and medical evaluation of the dental implant patient. So I think that these changes in format and grading really will go a long way in having candidates feel comfortable that they're treated equally.
Right, right. That's a great thing, because objective examination has been a goal of ours for a long time. So I want to thank you for making all these efforts to make our examination more objective. So with that being said, I hear and I know that the ABOI ID is delivering a virtual oral examination for the first time. I know it was initiated by COVID, but what do you think of the benefits of this new venue for this year? And what do you think about future examinations? What's the benefits there?
Very interesting discussion. I mean, the past year has been filled with, unprecedented challenges. The ABOI, in fact, canceled our 2020 exam due to COVID-19 pandemic. This year, as you mentioned, we've worked diligently to provide a virtual platform examination for candidates to complete this challenge. The examination process has been vetted to ensure a fair and comprehensive exam experience. And the use of this virtual platform might provide an additional tool for ABOI to use in the future. For example, while the decisions have not been finalized, the virtual platform might allow a more seamless experience for international students to seek candidate status. And a hybrid exam, which includes both a live and virtual component, is currently being explored for future exams. Throughout the nation, healthcare examining boards are all dealing with this issue. And I'm very confident that when we come out of this pandemic, we will have learned a number of things that will be beneficial moving forward for our candidates and for the board in general.
Super. I want to thank you for all your efforts, because I know you put in many hours in moving forward with a virtual platform so we can get our examination process done this year. Thank you for that. So, okay, so we have a lot of candidates. They all call the central office and they say, hey, how do I prepare for either the written or the oral examination? What do they do to prepare for these examinations?
Yeah, I can imagine. The part one written exam is, as you know, a 200 multiple choice test. These test questions require candidates to apply their knowledge of implant dentistry in clinical situations for the most part, rather than merely recalling or recognizing specific facts. If you're preparing to take the certification examination, I think you can go to the website of ABOI and go to the ABOI Certification Examination Handbook. And it lists all the test specifications that are used in the multiple choice written exam. So in addition to those topics listed in the handbook, I'd recommend the candidates consider taking the ABOI annual review course. I mean, the review course is typically attended by candidates preparing for the oral examination, but all the topics in the review lectures provide a comprehensive overview of contemporary implant dentistry and a solid foundation of information which is contained in the written exam. Finally, I think for the written exam, candidates should utilize textbooks, manuals, scientific journals, all of which should be dedicated to implant surgery, prosthetics, complications, and medical evaluation. I think that's a general advice that all of our candidates can use in preparation for both the written and the oral component of the exam.
Great. So this review course this year, it's going to be virtual, correct?
Yes, I'm very excited. It's going to be virtual. And one of the most interesting parts of the review course is the oral mock board examination. And certainly that's challenging to do virtually. And this year we've come up with a methodology in which we have pre-recorded 4 hours of oral mock boards between examiners and faculty members acting as candidates. Wow. So the end of each day, the attendees can sit back and view what a 20 to 30-minute exam really is like. And I think that's going to be very well received, in addition to all of the lectures provided by an outstanding faculty that I've been able to put together for this program.
Super. Looking forward to that. And I believe that's in July, right? Is that in July or June?
No,
July.
I think the review course is in May, I believe.
May, I'm sorry, May.
I think it's
check out those dates. I know they're on the website.
Yeah. Okay.
So speaking about preparing for the exam and doing those mock boards, some of the candidates that sit for the boards, as you know, are prosthodontists or stronger in restorative dentistry. So, and they have to understand the surgical part or defend their surgical treatment. So, well, how would you ask them to prepare? What would you expect from these candidates in preparing? Surgical
I mean, this is a very common question, obviously, and the short answer is yes. I mean, implant dentistry involves the art and science of tooth replacement. I mean, if you consider the fact that I think approximately 120 million people in the United States are missing one or more teeth, and our senior citizen population, 2 out of 3 are missing one or more teeth. So, you know, the initial step in that journey is the removal of a tooth. And that tooth removal is a surgical procedure. And if an implant restoration is planned, it's critical that a candidate be able to evaluate that defect and prepare to augment the defect in preparation for implant placement. Those augmentation procedures are also surgical procedures and involve everything from extraction site grafting to more advanced augmentation for vertical and horizontal defects, including sinus grafts and block grafts. So it is critical for the candidate to be able to discuss these procedures and describe in detail how these procedures are performed. I mean, the same applies to the actual implant placement. So while dentists might choose to limit the surgical experience in their practice and focus mainly on the prosthetics, it is critical to successful incorporation into their private practice that they're able to clearly demonstrate and understand these procedures, especially if they're trying to achieve diplomat status.
Right. Very important. Absolutely. And the same holds true for surgeons taking the exam. They have to understand the process. Absolutely.
Yes. And it's interesting you say that, John, because that was my motivation originally to join the ABOI, because I saw in my implant practice a lack of understanding the challenges with, prosthetically driven implant placement and restoration. And the ABOI national meeting that I attended was an awakening call for me as a specialist to say to myself, I have a number of, inadequacies in trying to perform at the highest levels. And one of the things I love about the ABOI and AID is that there's a camaraderie among general dentists and specialists, because we all have something to share and we all have something to teach each other. And at the end of the day, that three-dimensional exchange is what makes a competent and successful dental implantologist. Mm-hmm. So absolutely, my focus in continuing education is prosthetics and occlusion and aesthetics, because, after a surgical residency, I'm comfortable in that venue. So when I do participate in CE as a teacher or faculty, I find that I can clearly tell who has what level of experience when it comes to all the different avenues that you need to be able to walk down to be a good implantologist. And I try to tell our candidates, it's obvious you understand occlusion. Focus more on how to do the surgery, or it's obvious you know how to do the surgery. Focus more on treatment planning, because people tend to be in the comfort zone. But when you take the oral exam, you're going to be challenged in the zones where you're not as comfortable. And that's what separates this organization, I think, from others.
Well said. So, okay, so that's great. I got a lot of information from this evening, so I think I'm going to finish it up with, I guess, something personal. So, how has being board certified with the ABOI positively affected your practice or your professional career?
You know, achieving board certification in implant dentistry with ABOI is measurable proof of having undergone a rigorous examination process that accurately measures, you know, our skill and knowledge of the core competencies necessary to provide patient care. ABOI diplomats are, I think, are front and center throughout the country and internationally to take leadership roles in the dental implant community. And the prestige of being a thought leader or an opinion leader in our particular specialty is only one of the benefits of becoming a diplomat of the American Board of Oral Implantology. I sincerely believe that.
Super. Well, thank you so much. Do you have any other comments you'd like to give to the potential candidates?
Oh, we can go on and on. I know how passionate we both are about the organization, and it's my hope that we continue to expand our membership and come up with more and more ways to not only entice people to join the organization and seek board certification, but to prepare them.
Very good. That's our mission. That is our goal, to prepare candidates and to examine them properly. So, Dr. Leonetti, I want to thank you for taking time from your busy schedule. I know how much work you're putting in this year with our virtual meeting, our virtual review course, and our virtual oral examination. So thanks again on behalf of the American Board of Oral Implantology Board, and thank you to all our listeners. If you have questions, please call our central office or visit us, of course, at aboi.org.